everyone, it's Sarah here. In this video, I'm going to be going over how to interpret a CT head really quick. So let's get started. In order to understand what a CT is, you need to understand what an X-ray is. An X-ray is basically a medical image technique that uses a small amount of radiation to create an image of what's going on inside your body. And when that X-ray beam or radiation passes through the body, it's absorbed by different tissues at varying degrees. So for instance, if something's really dense structure like bone in the body, it will absorb more and thereby be whiter on the image, as opposed to a less dense structure like organs will allow the X-ray to pass through it and it will appear darker. And so in that way, we could take the densities and be able to diagnose pathologies, diseases, etc. So where does the CT come into that? CT is an X-ray. It's a rotating X-ray machine that takes multiple images from different angles of the body, and it uses those images then are processed by the computer, and it creates like a kind of like cross-sectional slices, I guess you would say, of the body. If you think about it, 3D images as opposed to just a picture, you have a 3D image. What are CT heads ordered for? CT head is generally ordered for head trauma to rule out bleeds, strokes, neuro symptoms like altered mental status, and also just monitoring, like monitoring brain tumors, infections, hydrocephalus, like stuff like that. So there are many different systematic approaches that you could go to interpret a CT scan. This is the one I use. I didn't make this up. This is not my mnemonic, but I just like to use it. It's called Blood Can Be Very Bad. B from blood stands for blood. C is cisterns. B is brain. V is ventricles, and B is bone. And the reason why I like this mnemonic is because it's easy to remember. Sometimes people make mnemonics and it's like you have to remember the mnemonic, let alone remember what the mnemonic stands for. So blood can be very bad. Most times when people are looking at CTs, they're looking for blood, so it's easy to remember blood can be very bad. So blood is blood, C cistern, B brain, V ventricle, and B bone. So let's get into each one. B is for blood. Blood on a CT head is bright white. There are different types of bleeds. The number one, not number one that it's the most common, just number one, I'm just going in this order. Number one is epidural. Epidural is located between the dura and the skull. So what you're going to see on a CT head, like shown in this picture, is you're going to see a lens-shaped white bright spot. Lens shape. So usually this is after a trauma, usually caused by a skull fracture, injury, etc. Usually they'll have a brief loss of consciousness and then either stop vomiting, neurodeficits, etc. So this is how it looks, lens shape, as shown in the picture. The next type of bleed that we're going to be discussing is a subdural. Subdural, as the name says, is between the dura and the arachnoid. Subdural is generally from a traumatic head injury, and they usually can have symptoms like headache, dizziness. In terms of a CT head, it looks like a crescent or a moon shape, as shown in the second picture. The third type that we're going to be talking about is subarachnoid. Subarachnoid is bleeding between the arachnoid and the pia mater. It's usually caused by an aneurysm or an AV malformation, but usually an aneurysm. Symptoms of that is sudden, severe headache. So they'll say this is like, quote unquote, the worst headache of my life. How that's going to look like on a CT head is like kind of like a spider web, as you see in this picture. Like the blood or the white spot is kind of sometimes looks like a spider web to me, usually caused by aneurysm. The next type is going to be an intraventricular. That is pretty easy because, as the name says, it's in the ventricles. So you see that the ventricles form like an X over here in this picture, and if you see white in it, then it's bleeding. Always look at both sides. Always compare, because you see white in one part, not in the other part. That should already clue you, and even if you don't even know what white is, hey, something's off here. Lastly, we're talking about intracerebral. So this type of brain bleed occurs within the brain tissue itself, and it's usually due to high blood pressure, hypertension. It can cause also severe headache, nausea, vomiting, etc. And that's typically rounded, as shown in the picture. So just to say it again, epidural, you're going to see more of a lens shape. Subdural, more of a crescent, moon shape. Subarachnoid, I like to think of it as like spider webs, but tracks, whatever you want to call it. Intraventricular, it's always going to be in the ventricles, and intracerebral is going to be usually rounded, and it's going to be in the brain tissue itself. So the next one is C. C stands for cisterns. What are cisterns? Cisterns are basically spaces or cavities within the brain that are filled with cerebrospinal fluid, or CSF. They're essential for the circulation and the absorption of CSF. In terms of looking at a CT head, you want to make sure there's no pus in it, you want to make sure there's no blood in it, white, again, blood, and you want to make sure that they're not absent or not effaced, because that could implicate a rising intracranial pressure. Are open. So the third thing is blood can be, B is for brain. So in terms of brain, the first thing you want to look at is a loss of gray-white differentiation. And what I mean by that is you want to clearly be able to distinguish the two of them. You want to make sure there's no loss of differentiation. It's not like you're saying the gray and white is kind of mixed. You want to make sure that's white, that's gray, and there's no loss of differentiation. I find this hard personally, but what I do is I look at both sides and I compare and I say, hey, this one's a little more off than that side. As you see in this picture over here, on one side, it's a little bit loss of differentiation as opposed to the other side. Another thing you want to look at is going to be a midline. You want to make sure that that is straight and it's not pushed to one side. So you want to remember that the brain is closed in terms of there's only X amount of space in the brain. So if there's bleeding or there's a mass growing or there's something else, everything is going to be shifted to one side. So you want to make sure that the midline is straight and there's no pushing. So what I like to do is I like to open up to the ventricles and make an imaginary line straight down, and then you'll see the ventricles on both sides perfectly, or it should be, as shown in the picture below. The fourth thing is blood can be very, very V in ventricles. So for the ventricles, you want to look, obviously we spoke about the blood before, so you also want to look for blood in the ventricles. You also want to look for dilation or compression or a shift in the ventricles. In terms of dilation, a lot of times it could be hydrocephalus, and you want to look for that, as shown in the picture below. Lastly, in terms of the mnemonic, is bad. Bad is for bone. B, bad bone. So in terms of bone is going to look bright white. It's going to be like real bright white. And what you want to look for here is fractures. Fractures I find sometimes you can miss it, but I find them pretty easy because fracture is basically a break in the bone. So you just look and you look for a little break and you compare, always, always, always compare. You want to look at the skull, you want to look at the facial, bones, etc. Sometimes you could even see a little bit of the cervical spine and see if there's a fracture there. Before I just summarize, I just want to say that I'm not a radiologist. I'm not claiming to be one either. Obviously, a radiologist has a much more comprehensive, in-depth way of doing it. This is just how I look at it really quick, just to see on the surface. I look at everything, and then I go through the blood. Can be very bad. Blood is blood, obviously, bright white. I look at the cisterns, I look at the brain in terms of differentiation, midline shift, I look at the ventricles, and then I look at the bone for any fracture, etc. That's the way I do it, as a really, really, really quick, not comprehensive review of a CT head. I just want to say that your friend here is comparing right side to left side, comparing normal to abnormal. Even if you don't know anything about CT, you never saw it, and you don't know how to interpret a CT, if you look at both sides and one's a little bit off, you'd be like, hey, why is this a little darker? Hey, why is this white and this one's not? And the same thing with seeing normal. When you see a lot of normal CT heads or even CAT scans or even x-rays or whatever you're looking at, when you constantly see normal and then you see something abnormal, it will just stick out. Even if you have no idea what it is, it'll be like, this is abnormal because every other one I saw was X and this looks like Y. So just reviewing, practice makes perfect. And like I said, this is no radiologist review. This is just if you want to quickly understand how to read a CT, you're looking at your patient's imaging, you want to just understand what's going on. Thank you for watching.